Hello, I crave your indulgence over the next few minutes to watch to the end. Three things could happen. Number one, you probably will learn something you didn't know. Number two, you will willing to subscribe. And then number three, willing to share. Now, in the part one, I helped us to understand what the pathology or the disease is in osteoarthritis. I said that the problem has to do with the cartilage. Now, in this video, I'm going to be talking about how to recognize the features of osteoarthritis. Now, I need to mention that these videos are not intended for you to become your own doctor, but basically for you to understand these conditions. Now, I'll say here that the most common joint or the joint most commonly affected by osteoarthritis are the knees. And so we're going to use that as a prototype in this discussion. How then do I recognize the symptoms of osteoarthritis? I'm going to be mentioning a number of features. However, some are more important than the others. I'll start with crepitus. Now, crepitus, we can describe it as joints making noise or the noises you hear coming from the joint. Some people describe it as a crackling noise. In the course of walking, you experience that noise coming from your knees. Now, if that's the only symptom or feature, please do not be disturbed. That can occur even in the absence of being diagnosed as osteoarthritis. Secondly, in osteoarthritis, it tends to occur in one joint and then subsequent involvement in the other joints. And so if we're using knees as a prototype, typically to start with one joint and then subsequently the other joint gets involved. Thirdly, and most importantly, pain. Now, this is the most dominant symptom and the reason why most people will seek help. In the course of walking, the patient experiences pains. However, when the patient is not walking, seated, or just relaxed, there's usually no pain. However, when he or she stands up to walk, climb the stairs, descend the stairs, or stand up from a position of prayer, or wants to kneel from a position of standing, he or she experiences pain in the knees. That usually is the description of pain that we see in osteoarthritis. A major distinction of the pain from osteoarthritis from rheumatoid arthritis is that the pain in osteoarthritis is referred to as a mechanical kind of pain because it tends to occur with activity, unlike the pain in rheumatoid arthritis that tends to occur mostly after a period of rest. In other words, the pain tends to occur or is more severe after sleeping, in other words, waking up in the morning or after a period of inactivity. Now, that's not to say that patients that have rheumatoid arthritis don't also have pain in the course of movement, but the dominant pain they have tends to occur after a period of rest. I'll be making a video on rheumatoid arthritis down the line. Another symptom that's worth mentioning is swelling. Now, sometimes patients that have osteoarthritis also do come down with swelling of the joint. And the way to explain this is that if you have a situation where there's been a fire incident, the people you usually will call around to quench the fire or put off the fire are those referred to as the fire brigade. And what do they come with? Water. And so when they come around, they would have to discharge water to put off the fire. So also, if the body senses that there is an inflammation in any part of the body, more blood cells will go in that direction. At the end of the day, there could be an increased production of fluid and so result in swelling. That's a very simplified way to explain the swelling that could occur when there is arthritis. Now, in addition to that, they may also explain stiffness. This stiffness tends to last usually less than 30 minutes, as distinct from the stiffness that occurs in rheumatoid arthritis that tends to last more than an hour. Other symptoms could be what is referred to as locking phenomenon, where the knee joint tends to lock, and then if care is not taken, may require these patients actually stopping the motion or stopping the movement, and then sometimes they describe that they almost fall or literally fall, which is like the knee giving way. Now, these are symptoms that tend to occur. Number one, we talked about crepitus. Number two, we talked about asymmetry, which is the involvement of one joint and then subsequent involvement of the other joint. And then we talked about pain, we talked about swelling, we talked about stiffness, we talked about locking phenomenon, and we also talked about the knee giving way. Thank you for listening to the end.